You started taking creatine, step on the scale a week later, and now you're 2 kilograms heavier. Your first thought, I'm gaining fat. But what if the scale is completely misleading you? I'm Dr. Elizabeth Miller, and today I'll show you what's actually happening inside your body. One of the biggest concerns I hear about creatine, especially from women and people taking it for the first time, is will creatine make me gain weight, look puffy, or become bulky? The short answer is that creatine can cause a small increase in scale weight, particularly when you're first starting taking it. But this is not the same thing as gaining body fat. To understand why, we need to separate 3 things that often get grouped together: water inside the muscles, digestive bloating, and fat gain. Creatine is primarily stored in skeletal muscle. When the amount of creatine stored in your muscles increases, the amount of water associated with that muscle tissue can also increase. This is commonly described as intracellular water retention, meaning the water held within the muscle cells. This is different from the type of fluid retention people often picture when they hear the word bloating, which is generalized puffiness or fluid accumulation beneath the skin. Research suggests that the early increase in body water is largely associated with the muscles, although studies don't all show the exact same changes in how fluid is distributed. This additional water can increase your body weight without increasing your body fat. The effect is usually most noticeable during a creatine loading phase. So a traditional loading protocol typically provides about 20 grams of creatine per day divided into 4 smaller doses for approximately 5 to 7 days. This fills the muscles with creatine stores relatively quickly. It can also cause a rapid increase in body water and scale weight, often somewhere around 1 to 2 kilograms, although the response varies between individuals. Some people gain less, some may not notice a meaningful change at all, but this initial increase is not necessarily temporary in the sense that it must disappear when you continue using creatine. So some of that additional water may remain while your muscle creatine stores stay elevated. What is usually temporary is the rapid week-to-week fluctuation. So once your creatine stores stabilize, your weight will generally stop rising from this effect alone. Does creatine cause bloating? In my practice, I frequently see patients for bloating, but the definition of bloating can mean a few different things depending on the person. Some people feel bloated due to digestive issues, which is a feeling of pressure, fullness, or discomfort in their abdomen. Others develop bloating due to inflammation, which can cause water retention under the skin, leading to a sense of puffiness around the body. But bloating when it comes to creatine use is usually a feeling of looking slightly fuller because the muscles are holding more water. This is not the same as subcutaneous puffiness or digestive bloating. Many people don't notice a visible difference at all, other than that their muscles are looking more swollen. Now, there's a less common type of bloating that people describe sometimes when taking creatine. So creatine can cause digestive discomfort in some people, but this is more likely when a large amount is taken at once. Taking 10, 15, or 20 grams in a single serving might leave more creatine sitting in the digestive tract, which can draw water into the intestines. That can contribute to bloating, nausea, cramping, or loose stools. This is one reason why loading doses are normally divided throughout the day in 5-gram doses. When somebody takes a lower dose, such as the 5 grams a day, they are much less likely to develop these side effects. It is also important to remember that creatine may not be the only ingredient involved. So flavored products can contain sugar alcohols, gums, sweeteners, or other additives that cause digestive symptoms in some people. I especially notice people get bloated with sugar alcohols like erythritol or sweeteners like sucralose. So switching to an unflavored creatine might also help. If a product consistently makes you feel bloated, then check the complete ingredient list rather than assuming it's the creatine itself that's responsible. Does creatine make you gain fat? Creatine does not contain a meaningful number of calories, and it doesn't directly cause fat accumulation. Randomized trials don't show that creatine supplementation increases fat mass. In fact, when creatine is combined with resistance training, research often shows improvements in lean body mass, and in some analyses, modest improvements in body composition compared with resistance training without creatine. So creatine can help your muscles regenerate energy during short, intense activities like strength training or sprinting. Over time, this may allow you to complete slightly more work, recover between efforts, or better maintain your training quality. That can support muscle adaptation, but it does not mean that creatine automatically builds large amounts of muscle or makes somebody bulky. It also does not override other factors that determine fat gain, such as overall calorie intake, activity, training, sleep, genetics, and hormone health. So if the scale increases shortly after taking creatine, the timing really matters. A rapid increase over several days, especially during loading, is much more consistent with a change in body water than a sudden increase in your body fat. What about creatine weight gain in women? We'll go deeper into creatine and women's health in episode 7, but here's a little bit about what you need to know. This concern can particularly be significant for women because many women already experience normal changes in the scale weight throughout their menstrual cycle. The luteal phase of your menstrual cycle, which is after ovulation up till your next period, your sodium intake, carbohydrate intake, digestion, hydration, and even the timing of a workout can all change the scale weight independently of your body fat. Adding creatine in can introduce one more short-term variable, but that does not mean that women should expect to look swollen or become bulky. Creatine supports the same cellular energy system in women that it does in men, and it may support strength, performance, recovery, and the ability to preserve or build lean tissue when paired with appropriate training. How much visible muscle somebody develops depends on their training program, nutrition, genetics, hormones, and consistency over time, not simply on whether they're taking creatine. It's also worth noting that women may have slightly lower muscle creatine stores on average, particularly if they consume little meat or fish. This is one reason why creatine is increasingly being studied across different stages of women's health. How to reduce the initial weight fluctuation or bloating. So if you're concerned about this, you don't have to complete a loading phase. You can start with 3 to 5 grams of creatine monohydrate per day, and this will gradually increase your muscle creatine stores, but it may take approximately 3 to 4 weeks rather than several days. The eventual muscle creatine levels can be similar. You're simply just reaching them more gradually, which may make the initial changes in water weight less noticeable. If you experience digestive discomfort, it may also help to take creatine with a meal, avoid taking large amounts all at once, choose a simple creatine monohydrate product without unnecessary additives, and check that you're measuring the servings correctly. A heaping kitchen spoon is not the same as the serving listed on the label. You also don't need to force excessive amounts of water, but you should maintain normal adequate hydration when taking creatine, just as you would with any exercise program. If symptoms are significant, persistent, or unusual, stop taking the product and speak with your healthcare provider. The most important takeaway is that body weight and body composition are not the same thing. Your scale is just measuring your total body mass. It can't tell you whether a change came from the water, muscle tissue, digestive contents, your sugar stores, or body fat. A high number does not automatically mean your body composition has worsened or you gain fat. So if you're monitoring the effects of creatine, avoid judging it based on one isolated weigh-in on the scale. Look at the overall pattern alongside factors such as your strength, training performance, recovery, how your clothes fit, and if body composition tracking is relevant to you, measurements taken under consistent conditions. Even body composition scales can be affected by hydration, so they may temporarily interpret water changes inaccurately as well. So, does creatine make you gain weight? It can increase scale weight, particularly during the first week of a loading phase. Does creatine cause bloating? Large doses can cause digestive bloating in some people, but creatine doesn't typically cause the generalized puffiness that many people fear. Does it make you gain fat or suddenly become bulky? Current research doesn't support that either. For people who want a gentler approach, starting with 3 to 5 grams per day without loading can gradually increase muscle creatine stores while reducing the likelihood of a sudden water weight fluctuation. The scale may change, but that does not mean your body fat has changed. If this helped clear up your concerns about creatine, subscribe to the channel and continue with the next episode where we'll break down the best dosing for creatine. I'll see you there.